My name is Deborah Anthony Larson, and I am very proud to be the President and CEO of Hospice Savannah, especially during our 30th year. Together, let's listen as some of our wonderful founders share their memories.
I remembered something I'd read, I think Carl Sandburg, and he said, "Without a dream, nothing." I remember in that first year actually giving 41 talks to try to explain what hospice was, what it wasn't, and that it was a concept of care and something that would really help the family as well as the patient.
So when this institution was started in 1979, it relieved a great responsibility off of many doctors, because many of the doctors had to treat the end-of-life patients themselves. And when I was in school, we were taught to treat everybody as though they were going to never die.
We had to overcome the whole idea of death and dying, because people didn't want to talk about it. It was taboo then. I mean, we're talking about 30 years ago, and nobody died then. Somehow you didn't. You never saw, in the hospital, you never saw a body. They always pulled the sheet up over the head, and it was something that you just didn't think about or talk about.
I was the chairman of the Health Council, for which Sally was staff, and that is where the real action began when Pat Peirce talked about hospice, and we appointed a task force to investigate it from the members of the Health Council and a few other people from outside.
On the Health Council, we reviewed projects that sort of were proposed for the community, and it was sort of an informal review involved with certificate of need. And I said, we always review other projects, but why don't we consider starting one of our own, and that hospice was such a great need. And the idea was accepted, and a task force was appointed, and Ann Stewart was suggested as a person to head the task force.
So when they asked me in, I think, December of 1978, would I chair a task force to look into, the study and planning for a hospice, I remember saying to, I think, Sally Mandel, who was at United Way then, and I said that, if we can do something, I don't want to have anything to do with just a study and have it put on a shelf.
We were trying to get things done as quickly as possible. We were getting excited about it. We were reading about hospice, and Ann Stewart was giving the leadership to the study committee, and she went to England on a vacation trip and visited St. Christopher, the original hospice, brought back a suitcase full of material, so she was hooked.
There were so many people that came to get involved. I remember that we had 40 people on the task force. We had doctors, clergy, social workers, just volunteers, community people. Everybody was so interested. And so from there, we had our name. We had our first meeting at the First Presbyterian Church. It was absolutely full. I think there was standing room. They had to go get more chairs. And we started our volunteer training program, and we had over 75 people come to take it. Just so much interest that you knew that this was something people were just sorely needing, and the community really woke up to it, I think.
This was a grassroots organization, and it just came up out of people volunteering their time and their effort.
I knew that one day there had to be a place like Hospice House. There had to be. And I remembered something I'd read. I can't remember who it was. I think Carl Sandburg, and he said, "Without a dream, nothing." So I think that's what, in my mind, started thinking about someday we'll have to have a place for the people who can't be cared for at home. sometimes when I look back at it, there's so much that I'm grateful for. But one of the things was that we were able to open Hospice House in 1993 with no debt service. Completely paid for, everything, furniture, everything. And it was because of this generous community, absolutely, that wanted to have a place. And you see now, with Hospice House, there was something visible people could see. When we were only giving home care, people did not understand what hospice was. Of course, we were helping people to remain at home where they wanted to be, where most people want to be, even before ever thinking of coming to Hospice House. But you couldn't see it, so we had to explain it. But when we had the facility, then they could see, it was a visible sign, and they could see it.
I'm really pleased with the feeling of this building, the friendliness and the openness that's here that is different from hospital settings for people who've been ill.
It was one of the most valuable, most interesting and rewarding thing I've ever done in my life. Hospice was my passion. It really was.
Well, my wish for Hospice Savannah and my message is, please continue to do the good work that you've done so far and improve it if possible. I already know we got a world-class hospice, so let's keep it up.
Congratulations on an amazing job, I think. I think it's just been beyond my expectations, certainly in those early days. I think we started off with, small hopes, but now it's just grown beyond. I think everybody will say that who was involved in any way, in the early days. It just amazes me.
I liked the way hospice has become such an integral part of the community. I find as I go around and I tell people I'm a hospice volunteer, I get feedback almost from everybody. They say, oh, my husband, my daughter, whatever, was in hospice, and they were wonderful and really pleased with the response of the community.
Well, I just hope hospice continues with the fine people that have been working on it all this time. There were just an enormous group of people who did a wonderful job, and I think their successors are continuing that, and I hope they keep on.
Just continue the high quality care and never ever let go of your principles and your ethics. I think that's so important. And can just continue to spread the word about hospice so that people welcome it, because it is the way that people can plan for a good death and a meaningful death. So I think, just continue doing what you're doing, caring.